Hi, I'm Liz Perez, and I'm going to be going over the pathophysiology of refractive errors. Refraction is a term that basically describes the bending of light rays as they enter the eye. Emmetropia is a term used to describe normal vision. In this case, light rays are bent to focus images precisely on the macula of one's retina. With ametropia, however, this basically describes the presence of a refractive error, any refractive error. So what this means is parallel light rays entering the eye are not refracted. In other words, they're not bent to focus precisely on the retina. Just know that refractive errors are a type of vision problem that just basically makes it hard for one to see clearly. This happens when the shape of one's eye keeps light from focusing correctly on the retina, which is a light-sensitive layer of tissue on the back of one's eye. Refractive errors are the most common type of vision problem, and there are 4 common types of refractive errors that we're going to cover now. So the first one, known as myopia, is oftentimes just referred to as nearsightedness. With myopia, this basically makes objects far away appear pretty blurry. Then there's hyperopia, and oftentimes this is just referred to as farsightedness. And in this case, objects that are nearby will appear pretty blurry. And then there's astigmatism. Astigmatism will make objects appear blurry whether they are up close or far away. Additionally, oftentimes objects will appear distorted to one who has astigmatism. Last but not least, there's presbyopia. And with presbyopia, this just makes it really hard for the middle-aged and older adults to see anything up close. Thank you.
Hi everyone, my name is Ashley, and I'm going to be talking to you about the signs and symptoms of refraction of errors. So symptoms are having a hard time focusing or seeing certain things, blurry vision, eye strain, squinting, and sometimes you may even have headaches.
Hi, my name is Jason, and I'll be talking about diagnostic tests. Some common diagnostic tests that can be used to determine if there is refractive error includes the use of a Snellen chart or retinoscopic examination. The Snellen chart is found almost in every clinic and eye doctor's offices where refractive errors can be estimated, but can be definitely identified with the use of a retinoscopic examination. During an examination with the Snellen chart, the patient is standing 20 feet away and is instructed to read out the letters on the chart, beginning at the top and moving towards the bottom with one eye covered. The smallest roll of letter that the patient reads accurately can determine the visual acuity in the uncovered eye. With the retinoscopic examination, a psychopedic drug such as cytopenolate will be used before the examination to dilate the pupils and temporarily paralyze the ciliary muscles, which prevents accommodation. This medication is used to examine the internal and external parts of the eye and determine the type of lens that will correct the refractive error. It is important to teach patients that sunglasses should be worn until the medication wears off, as sensitivity to light may be present. They should also be informed that this drug causes blurred vision, so driving and reading may not be possible until the effects are gone.
Hello, my name is Paulette Rodriguez. Some common medications that are going to be given are called cycloplegic drugs. What these drugs do, it paralyzes the ciliary muscle in the eye. One of the common medications that are given is cyclopenolate, and again, the drug action is to paralyze the eye muscle. And this medication is contraindicated in patients that have glaucoma because the increased intraocular pressure that will be there. And common education things that we want to teach are to wear sunglasses to protect the eyes. We also want to educate on driving and reading that will be impossible. Thank you. Common medical treatment is mostly treated with eyeglasses, corrective lenses, or surgery. The corrective lenses are going to bend the parallel lights rays so the coverage of the macular portion of the retina is better. We're also going to have surgery, which is LASIK or a PRK. And what these do, they use laser energy to reshape the cornea. Thanks.
Question number 1. A client recently diagnosed with refractive error asked the nurse, what are the 4 common types of refractive errors? Which of the following would be the correct response? The correct answer is C. The 4 common types are astigmatism, hyperopia, myopia, and presbyopia. Refractive errors account for the largest number of vision impairments in vision. Hyperopia, myopia, astigmatism, and presbyopia are the 4 common types of amyotrophic disorders. Question number 2. You're assisting a physician with a retinoscopic examination. As the nurse, you know that which part of the eye is affected most by refractive error? A. Lens, B. Retina, C. Pupil, D. Iris. If you selected B. Retina, great job, that is correct. When parallel light rays entering the eye are not refracted or bent to focus precisely on the retina, it keeps an image from clearly focusing on the retina. This would indicate the presence of a refractive error. Question number 3. The nurse is assisting the physician with a patient who has stated he has refractive error. The patient's wife states he can see things close up but not further away. Which of the following amyotrophic disorders does the nurse recognize? A. Myopia, B. Astigmatism, C. Hyperopia, D. Glaucoma. The correct answer here is A. Myopia. Myopia is also known as nearsightedness. Due to an elongated eyeball, distance vision is blurred and items that are close up are much clearer. You are assessing a patient in an ophthalmologist office stating a recent diagnosis of refractive error. As the nurse, what signs and symptoms should you expect the patient to report? Select all that apply. The correct answers here are A and B, eye strain and difficulty reading or seeing. Common signs and symptoms of refractive error include difficulty reading and seeing and eye strain that may also lead to headache.
During the patient examination, the patient had cycloplegic instilled. Which information should the patient be aware of before leaving the facility? A. Blurry vision may occur. Wear sunglasses until agent wears off. B. Wear a hat and loose clothing. C. You may continue to drive. Or D. You should have no problems with reading. And the correct answer is A. Blurry vision may occur. Wear sunglasses until agent wears off. The rationale is, with cycloplegic agent, blurry vision may be present. Sunglasses should be worn until the agent wears off. In addition, the patient should be instructed that driving and reading might not be possible until the effects of cycloplegic drug is gone.